I'm going to talk to you about some soft tissue techniques for the lower leg. So I like to treat the lower leg in this position with my thigh bolstered up under the client's ankle. So it puts the calf in a nice relaxed position where we can start to incorporate a lot more active and passive movement through the ankle. So if we find a tight area, so we're looking for those bands, particularly into that gastroc after that muscular tendinous junction. If we find a tight area through there, we can pin it, hold it, and just glide through with our fingers. If it's quite a stubborn area, we can pin that and start to incorporate some passive movement into dorsiflexion, so really lengthen that tissue out. On someone that does have maybe a little bit more muscle bulk through the lower leg, we can use our forearm, so we're blocking that tight tissue, passively dorsiflexing and gliding through the length of that tissue. So it's a really nice lengthening technique. Okay, so once we can start to get some good movement through that area, or the tone starts to die down, we can block those particular areas. So if there's a certain tight band through that area, we can block it and then have the client move into some active dorsiflexion. And we're just sliding through that tissue as they dorsiflex. So that's a really effective way to get some good tone changes through the lower leg. We can even look at this medial compartment, so dragging that tissue away from the tibia. So for anyone that may present with that chronic compartment syndrome or that medial shin pain, opening up, sort of dragging some of that tissue away can be a nice way to relieve some of that tension. On the other side, we can look at treating through the fibularis muscles, and same goes, we can block those tight areas and have the client move through plantar and dorsiflexion or inversion, eversion. So give those areas a go, but try it in this position. It's a really effective way to treat.